Hi. We're going to talk about mindfulness and depression today. And to get started, could I ask you first to describe what would you say, how would you define what depression is, or define what an episode would be to get us started? Thank you.
It's a really good question. Depression can come in lots of different forms. For some people, it's a mood which is there all the time, of feeling down, feeling bad about themselves, feeling irritable perhaps with other people, feeling grouchy. Now, most of us get those feelings from time to time. Some people have that a long time, for weeks and weeks and weeks, sometimes lasting years. But how we define an episode of depression is where you get a few of those symptoms occurring all together very intensely in a way that really impairs your functioning. People who are grouchy can still go to work, but people who are depressed actually find that they just can't function. And the diagnosis of depression involves, first of all, meeting one of two criteria. Either got to have low mood or just lack of interest in things, and most people have both of those. But then they need other symptoms as well, like they can't eat properly, or they can't sleep properly, or they feel guilty about something all the time, or they feel suicidal, or they can't concentrate, or they feel very fatigued with no energy. And when you get 4 or 5 of those things lasting at least 2 weeks every day in a way that impairs functioning, that counts as a clinical episode. However, for most people, it's very rare to have only that for 2 weeks. For most people, it's between 6 and 9 months.
These are people that would have depression. I mean, rather than ordinary people who might just eventually pass out of this mood after a couple of weeks.
Indeed.
Okay.
Indeed, depression tends to pass in its own time, but usually after 6 to 9 months. But it's already done a lot of damage in that time.
Yes.
Work, their families been under a lot of strain. And when people get depressed, if they first present themselves as an early adult to the clinical services, then if you follow them up for 20 years, it turns out that about 4 months out of every 12 for every year have been in a state of depression.
Oh, that's a lot.
It's a huge thing. It's one of the biggest burdens of disability in the world.
You mentioned earlier in your questions or your explanation about people who actually, this MBCT program is helpful to people who have long-term histories of either chronic depression or frequent episodes. When you say long-term, at what age in the general population does depression start?
Well, we see people who've been depressed at least 3 times before they come to us, because we're interested in helping people with this most recurrent and the most damaging pattern of depression.
Right.
And our research has found that for them, half became depressed before the age of 18. So by the time we see them now, they're between 35 and 60 years old generally. That's the age at which we see them.
Right.
Have already been depressed 3, 4, 5 times in their life. But they first became depressed before the age of 18, half of them did. And when we look at the data, the pattern of data suggests that their first depression most commonly happened between the age of 13 and 15 years old.
So the early teenage years is when you start to see it present.
Yeah.
Right. And how, when you're looking at the teenage population, how do you differentiate depression from sort of other typical moody swings of teenage behaviors?
It's difficult.
Are there clues that flag this?
One of the things that we said at the outset was depression was this combination of low mood and lack of interest, but combined with not sleeping, not eating, suicidal thoughts, feeling guilty out of proportion to a particular thing, having no energy at all, and having those sort of constellation symptoms in a way that destroys the functioning most days for at least 2 weeks and probably more.
Right.
So that's actually quite a serious condition, whereas most of us and most teenagers even, they go up and down.
Yes.
They have 2 or 3 days when they feel bad, but they come back up.
Right.
And although for most parents it can be a very worrying time, you have to bear in mind that even if they do get depressed, 50% will probably not get depressed again.
Okay,
so it's not inevitable.
They may just outgrow it.
They may just outgrow it.
Yeah.
And so
not to be alarmed by
exactly. I think
parents of teenagers.
Sure. I mean, there's enough for parents of teenagers to worry about without thinking that my son or daughter is very depressed. I think if they One thing is to see how they're getting on with their friends and other family members.
Social connections.
Social connections.
Okay.
I mean, many teenagers, for example, that have enormous arguments with their own parents
Oh, yes.
don't have arguments with their friends' parents.
No.
And their friends' parents think they're wonderful.
Right.
Yeah? So why do their friends' parents think they're wonderful? Because when they go around their house, they're fine, they're polite, they're not moody. It's very situational. And most of us as parents often see the worst side because they reserve their worst side for us.
Yes.
They think we can take it.
But
they may be right.
But a child who struggles with depression might not even be able to connect when they go to the friend's parents' house.
That's right. It's going to be pervasive.
Okay.
I think. That's the point.
Right.
It's going to be a lot of symptoms all the time, and I think that sense of just withdrawal is important to look out for.
Right.
But even then, sometimes it can just recover spontaneously. So I think it's worth asking as a parent, worth asking other parents.
Right.
Using your own social networks.
Yeah.
Asking your own GP.
Right.
And so you get support for the inevitable hard business of being a parent of a teenage child.
Right. In your studies that you conduct with your test groups, do you ever target teenage group, that profile sort of maybe 13 to 17, 18? Do you do work on just their behavioral component?
There are many studies of adolescents using mindfulness now.
Right.
Not so many randomized controlled trials.
Okay.
Gina Beagle in America has done a trial of adolescents who have a range of psychiatric problems and found it's very useful.
Right.
And there are lots of schools programs. A schools program out of Penn State, for example.
Right.
We've got a schools program that's just published an article in the British Journal of Psychiatry, led by Willem Kijken again, with a whole group of people that piloted the use of mindfulness in schools.
Right.
And there's some work going on in Institute of Education in Hong Kong, for example, mindfulness in schools. When it's used in schools, it tends to be used as a universal intervention rather than targeting or trying to find the depressed child.
Yes.
It's the whole class.
Yes.
And then if it helps depression, it's a sort of byproduct of just training attention and life skills in general. It's about the flourishing of young minds rather than targeting those who are vulnerable for depression.
Right.
But the research suggests that it does help reduce depression if it's there in the classroom, and it also helps prevent new episodes of depression over a 3 to 6 month period.
Right.
So even when you don't target it, when you don't specifically ask who's depressed, not that you would,
No.
but if you use it for the whole class, those who have got a tendency to depress do get the benefit.
Right. Switching back to the adults for a moment, those teenagers that have grown up, the long-term sufferers, which you say this treatment is quite effective for when they've tried a variety of different therapies. What is your sort of general success rate? And, why would you so strongly recommend using this therapy for long-term sufferers?
The success rate with the people who've had at least a 20-year history, who've had 3 or more episodes, who are extra vulnerable because they had traumatic childhood and adolescence, we find that the risk goes down by at least half.
Okay.
So
it's extremely beneficial.
Yeah. I mean, in our first trial, it went down from 66% to 37% relapse rate. In the second trial by Dr. Helen Ma and John Teasdale, went down from something like 78% to 36%.
Right.
In our recent trial, the risk of the hazard, as they call it on the statistical test, went down by 57% for the most vulnerable, these people with a traumatic history.
Right.
So it's not that this is the only approach.
No.
It adds to the family of approaches. So we wouldn't claim this is the one you need to use in all time for all people.
Thank you for clarifying that.
Because there are other things to do this. Obviously, you can take antidepressant medication and other psychological treatments. The psychological treatments that are more structured are the best to use.
Right.
There's not a great deal of evidence that long-term psychoanalysis, for example, is very helpful.
Right.
But shorter-term structured psychotherapies like cognitive psychotherapy is very useful.
Yeah.
And so we shouldn't think that this is going to elbow out other
Yes.
approaches.
It's just adding to
It's
the
adding to the
repertoire of
mix,
another choice.
Indeed. And I
Okay.
think that the reason why it's particularly useful is for some people, they don't have to talk about themselves in this. It's not like a therapy as such.
Yes.
They go to class to learn skills, and if they want to, they can just sit there. They don't have to say anything apart from their name at the beginning. Give their first name, and then they can just be quiet.
Right.
And they can just learn the skills.
Right.
They don't have to talk in class.
No.
They can just show up.
Right.
And for some people that's a blessing.
Yeah.
That they don't have to
A little bit
go
of
over
anonymity.
everything. That's right. They don't have to go over their past.
They already think too much about lots of things
That's
anyway.
Right. That's right.
On that note, I actually just had another question. Going back to the Buddhist influence and the sort of origins of the inspiration, does it ever come up with people that they question, oh, is this something Buddhist? Because if they come from a different religious tradition, are they bothered by that fact? Or they're a bit shy to try it because they feel that it's some sort of Buddhist doctrine that they're being asked to, perform?
That does happen from time to time, but not as often as we might have imagined. Occasionally people who come from another religious tradition, for example, find it difficult. But mostly if they are strongly networked in, occasionally in Britain, I found people who are networked into a certain Christian family, and perhaps their pastor or their minister have said, oh, I wouldn't do that Buddhist meditation, that's not Christian.
Right.
And fair enough, if they have a social network and they're being supported by anything else, there's lots of other things they could do. So I don't push it with them. If they feel uncomfortable, why would it be important to push it? But for most people, it doesn't even come up. We're very open in our writings and what we say about its origins.
Right.
But it's taught in a secular context. And we explain that if they ask, and they don't often ask, that the Buddha was not a Buddhist.
Right.
That it's expressing universal truths for all of humanity.
Right.
And that part of the message is to try it to see. It's an empirical approach.
Right.
It's about seeing if this is helpful, not a doctrinaire approach.
No.
That it comes out of the practice. So what have you got to lose?
Yes.
Just try it for 8 weeks, see how you get on.
Yeah.
And in our recent research, we found that you don't have to be off your antidepressants and well to start this program. You can even do it when you're depressed. When we first we thought, it wouldn't be for people who are depressed now because they couldn't ever meditate. They couldn't concentrate.
Yes.
It turns out that people have tremendous courage. Even when they're quite depressed, it seems they can get some benefit out of this practice.
Yes.
And that's a big surprise.
I'm really happy to hear you clarify that because I actually have been a meditator myself for many years, and I have friends that are depressed and take antidepressants on a regular basis, and they attempt meditation and give up very quickly. And I've been sort of casting around for a good suggestion to make for them to try something, because they do get discouraged easily. And maybe it's the context or the framework that they're learning it in that they need to try something like your program to help guide them in.
I think one of the skillful things that John Kabat-Zinn did was to modify his experience of retreat and the meditative traditions to give more support to people.
Right.
So, for example, typically in a monastery or in a retreat center, instructions will be given and then there'll be long silence.
Yes.
His approach is to give some instructions, leave some silences, but then gently guide people throughout a 40-minute practice to bring people back. Yeah. And that means that actually, while it's actually happening, that your mind goes off and you find yourself judging and you say, I can't do this, which is what defeats most people, especially if they're depressed. There's a voice there saying, you can't fail at this. Yes. If your mind goes off, just notice it's gone. Okay. That's not a mistake. Yeah. That's what minds do. If you've got a mind, it will wander.
Yes. And,
so,
come on back.
Come on back. And that's the meditation. It's not that your meditation has failed. That is the practice.
Right, exactly.
But you need to hear that 1,000,000 times because your mind's going to go 1,000,000 times.
Of course.
So the voice is able to bring people back. And then, of course, it's not just sitting meditation, but a body scan meditation where you learn to put your attention in the body. That's lying down. Right. So people don't even have to sit. The first long meditation is lying down, not sitting. There's walking, there's movement, there's simple hatha yoga. Yeah. There are things where people can be more embodied. For some of our suicidal patients, for example, they can only do the yoga. They can't sit.
Okay.
And so they find
right.
the yoga is their entry into meditation.
Because they can focus on movement.
Because the movement gives them loud
Yes.
sensations. The body
Right.
scan, maybe the sensations are there, but they're quite quiet. But the
Okay.
yoga gives loud sensations. And in a lot of this work, it's about dropping down from the head to the body.
Yes.
And indeed, in our 8-week program for mindfulness-based cognitive therapy for depression, we specifically ask people, once they've learned to stabilize their attention in the first 3 or 4 weeks through the more concentration practices,
Right.
to, as they move into broadening into the more sort of Vipassana type practices, to use the body as their vehicle for knowing, a sort of direct knowing of what's going on in their mood and their mind.
Right.
Rather than staying up here to try to work it out,
Right.
just to focus on the body. Where is this felt in the body?
Yeah.
Now, that's got a lot of similarity with Gestalt therapies and other body-focused therapies.
Yes.
But it turns out to be a really wise move because you're dropping down the surface of all the chaos, under the surface of the chaos, into a quieter place.
Right.
So these are very carefully chosen meditations and cognitive exercises specifically for people who are depressed.
Yes.
Who might have tried and given up because they say, I can't do this.
No.
And
they can't maybe exit their mind in the first place.
That's right.
But as you say, the vehicle of the body gives them another place to dwell first.
Yeah. And often they can be
Yes.
very perfectionist and
Yes.
and it's really easy to try too hard.
Mm-hmm.
I mean, certainly I don't know what it's like in this culture, but in the West, exhaustion often comes not from just being lazy, but from trying too hard.
Mm-hmm.
And so if you use the old analogy of the tuned instrument,
Yes.
of the string being too tight or too loose, most people, when they feel they can't meditate, they tighten the string. And then they think, I'm having problems, so they tighten the string again.
Oh, yes.
And then they think, I'm not getting this, so they tighten the string again.
Yes.
And so part of the instructions is to let yourself off the hook a bit.
Yes.
To loosen the thing, to try to find the stringed instrument's own voice from loosening off to start with.
Yeah.
And coming back in, and then finding the right pitch.
And even exiting the body, as part of your therapy, do you guide them to pay attention to simple things like brushing their teeth every day?
Yes, indeed.
Eating exercise, walking up steps.
Yeah.
Those are also part of things for
Absolutely.
them to observe and be aware, develop awareness of.
Yes, indeed. So
Yeah.
right from week 1, they are asked to select one routine activity like brushing teeth, walking upstairs,
Right.
that they're going to pay attention to.
Right.
And-
They
and
probably
then-
never realized what they were really doing.
Well, indeed.
I think most of us don't.
It's a good question to ask. What's your other hand doing when you brush your teeth? I mean, do you know
I
what
actually have to think about that.
Well,
What is my
precisely.
other hand doing?
you don't know. It might be up to no good. You better find
Right.
out. I mean,
Yes.
who knows? We
Yes.
just don't attend to it.
No.
We don't attend to it. And why would we?
True.
But I mean, usually we're planning our day.
Yeah.
Even when we're showering, we're planning our day. Now, do you want all those people in the shower with you? All the people at your first meeting, your second meeting, your third meeting. Why not just be in the shower?
Right.
So there's the invitation. Just shower when you're showering. Just brush your teeth when you brush your teeth.
Right.
Just walk upstairs when you walk upstairs. And that, 8 weeks of that, and sooner or later, there comes for most people a transforming moment when they think, oh my gosh, I didn't even realize I was alive.
Wow.
And now I get it. And that changes them forever.